Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Oxalic acid. Oxalic acid acts locally. It causes no action or minimal action on intact skin or on mucous membranes. It causes bleaching and corrosion on skin and mucous membranes, and because of this the skin or mucous membranes appear white. Systemic action on GIT is similar to sulfuric acid. Vomitus is called as coffee ground vomitus because it contains mucin and mucus and acid hematine. It causes renal damage by causing tubular necrosis, causing uremia. It causes excessive hypocalcemia. So, oxalic acid causes tetany, convulsions, tingling, and numbness of the fingers, tips, and also legs. Treatment. Treatment is you should do gastric lavage with caution. Gastric lavage with caution can be done along with calcium gluconate and calcium lactate. Oral calcium gluconate or calcium lactate can be used. Intravenous calcium gluconate 10 milliliters 10% is the specific antidote. In severe cases, parathyroid extract of 100 units can be used. Medico-legal importance. Medico-legal importance is used for ink removing solutions, for forgeries, or for illegal overwritings. It is used to remove the boat marks on the fingers.
thank you and thank you for watching.